This global launch in Geneva is the first of a series that we have. And as you can see on the screen, we're going to be in Washington, so we're going to meet you again in Washington, but we're going to be in Amman, in Dakar, in Dhaka, in Colombia, and what did I forget? In Nairobi, of course. And Chichi Undiye, one of the co-chairs, is going to be there. We wanted to organize regional launches, so they're going to be face-to-face and live-streamed for the regional actors. They will be in different languages, in Arabic, in French, in Spanish. And the idea is very illustrative of how we want to disseminate the findings of this report. Each of these events, and I want to thank the host, they are local organizations or international organizations. Alima is going to host us in Dakar, BRAC School of Public Health in Bangladesh, Pop Council is going to host us in Nairobi, and EMFNet in the Middle East. And I thank them very much for taking the time and making the effort to welcome us in these settings. Of course, this report is very much the start of a collective movement that's going to last a few years, and we are ready for that. We will focus on alliances, on evidence and science, and on creating a political movement. So, Danielle, politics is at the heart of this report. All our commissioners and NextGen on day one, this is day one, are ready to go for it, and they're pushing for it. We want to make sure that these recommendations, ambitious, possible or not, but we're going to push for that. And we want to make sure they're going to be translated into measurable changes. First of all, we will establish a global humanitarian alliance with regional and thematic hubs with a secretariat. So basically, we're calling on you to join this movement. We want to make sure that we're going to have people from different disciplines, different areas, different sectors. We want to defragment the system, as Erika said. And we'll create working groups, and we're going to publish public reports. We're going to engage with operational organizations like Médecins Sans Frontières and ACRC and others, and the faith-based organizations. We will engage with diplomats and, of course, local actors. We will organize strategic dialogues with donors, Western donors, but as well donors in the Gulf states and in other parts of the world. We want to make sure that philanthropists as well can be part of this movement. What we are going to do as well, we're going to monitor the system changes and the accountability across the sector. And to do this, we have defined a set of measurable indicators. And they're all related to governance, financing, accountability, and protection. And this set of indicators are going to be a dashboard for us. And what we are going to do, an observatory, is going to measure them and report on them every year or every 2 years. And because we are universities, this is our third line of activities, we are committed to build and strengthen the capacities of national universities, local actors, making sure that the science we produce is going to be open access, making sure that they will get access to the latest knowledge and evidence through courses or events we can organize. Our fourth area of activities, and because we are researchers, we will create a humanitarian system transformation lab where we are going to design, test, and evaluate different innovations in the system that can contribute to the changes in the system. And they will be based the changes we're going to make are going to be based on the urgency, the political feasibility, the resource intensity, and the systemic leverages they can have. We will touch upon governance, financing, localization, and accountability. The value of this commission will very much depend whether it contributes to shifting power, reshaping incentives, and improving the health and protection for people affected by conflict and displacement and other crises. And this is our commitment as a commission. Thank you very much. Without, just to close and wrap up this global launch, I'm invited Dr. Richard Horton to give us some closing remarks. Thank you very much.
Well, thanks, Carl, and thanks everybody for staying all morning with us. What a morning it's been. Really a huge thank you to the whole team for what you've delivered. I just have two parting thoughts. I believe in a very old-fashioned idea that despite the plain insanity of our times, the world that we do live in is rational. Not every day, and not in a linear way, but fundamentally, truth will rule over falsehood eventually. And science, data, evidence is the most reliable tool that we have as an instrument for political and social change. And that's the essence of the purpose of Lancet commissions and Lancet series, indeed, the whole idea of the Lancet itself. Second, we will succeed in our ambitions and our aspirations through tenacity, through repeatedly coming back together, repeating our messages, building a strong partnership that Carl has identified. We've done it in women's and children's health. We've done it for climate and health. We've done it for non-communicable diseases. We're beginning it for plastics and health. We had a meeting last night to begin it for gender justice. We know how to do it, and with you, we can do it. The next steps are to amplify your messages through these launches, to assemble this coalition, and to plot. And you have options. The accountability framework that Carl has mentioned, let's put that together and let's publish that together. Let's use that as an instrument for political change, coming back again and again and again. Let's meet again next year to look at how our plan is being executed. Let's think about regional commissions and regional activities. And finally, please understand that all of the Lancet's work is rooted in an idea of justice. Every single piece of the science and data and evidence we publish is rooted in that notion of justice. And my inspiration for thinking about justice is John Rawls and his 1971 book, A Theory of Justice, and the books and writings that came after that. And in John Rawls's writing, he talks about the concept of a realistic utopia, the sense that we can extend the limits of human possibility. So please, let's leave this room today ready to find our inner activist to extend those limits of human possibility and to reach that realistic utopia. Thanks so much, everybody. I think it's lunch.